Your work is to discover your world and then, with all your heart, give yourself to it. Buddha. I'm Samantha Santich, and I chose to reflect on nursing as a calling because it can be a destiny for some people. And through my life experiences, I have learned why I chose to be a nurse myself. Nursing as a calling is a phrase that can mean many different things to many people. To me, the phrase nursing as a calling means that it is something that some people are meant to do. This type of job isn't just a career, but a lifestyle. We, the students that are being called into nursing, are here because something in us strongly wanted to help and make a difference in patients' lives. I feel that I was called into nursing because of what I have experienced in my life. I was a Riley kid, and the nurses were so nice and caring to me. I wanted to continue that and make an impact on people's lives like they did on mine. Through all the surgeries I have had, I was able to appreciate and get to know that nurses in the nursing career was what I wanted to do and be. I feel that being called into nursing is an enlightening experience. It shows that we feel that we are being called into a profession where people depend on us, and that we will be making a difference in people's lives, not only daily, but for the rest of their lives. The summer before I started college, I had my last surgery, and this was really when I felt my calling into this career. I remember after my surgery, I had to get my chest tubes removed, and I was so scared, but the nurses on duty were so caring, and they started asking me questions to get my mind off the pain and telling me that everything would be okay. They were there for me when I was scared and in pain, and I would like to do that for others. 3 months later, I went to school orientation at IUPUI, and I declared my major as nursing, and I never looked back. They made an impact on me that will last the rest of my life. In this course, I have learned to communicate effectively not only with my patients, but also with my peers. I feel that this will help me in my nursing career because nurses communicating with each other is a big part of patient care, and making sure that the patient is getting what they need. As well as peer-to-peer communication, nurse-to-patient communication is just as important. Making sure the patient is comfortable and treated right is a big part of nursing. Someone who is called into a profession has the responsibilities that that profession upholds. Like nursing, there are many responsibilities we have. In the career of being a nurse, the responsibilities are very important. Along with being professional, patient care is the main responsibility. With patient care, we are able to help each and every patient and make sure their experience within the hospital or within the type of care they are receiving is effective and will help them in the long run. I feel like anyone that goes into nursing really wants to make an impact on their patients. And through all these responsibilities, it can be possible. A call into a profession can have so many responsibilities that it can sometimes weigh a person down. So making sure a call is sustained over time is by making sure it is fully what you want to do with your life. Within nursing, education can also really help sustain this career. Nursing is a lifestyle, and it will someday be the way I live my life. I will sustain this by making sure it is something that I fully enjoy.